Obamacare. I've said it before and I'll say it again. Having access to a doctor is a human right. But where do you stand, my vigilant viewers? That's today on Off the Grid. President Obama has announced that the Affordable Care Act, aka Obamacare, is working. You don't say. What do you guys out there think? That's on the docket for today. Alex in the command center, give us your latest on Obamacare, but not quite yet. First, I gotta talk a little bit and ask, are you guys bored back there at the command center? You're sending me a topic now that's only been in operation for about 1 year. Anybody that knows government knows that when you establish something from the ground up brand new, it's going to take at least 5 years. And so I think we're premature. But anyway, fire away, Alex. What do you got?
Well, President Obama stated 7.1 million Americans have signed up for health care through the federal exchanges set up by the Affordable Care Act, reaching the White House's initial projection. But let's not forget that the rollout of exchanges has been messy. The website, healthcare.gov, was useless for weeks after its launch last October. Obama himself stated that the law wasn't perfect, but the bottom line is this. Under this law, the share of Americans without insurance is down, and the growth of the cost of healthcare is down. He said that's what the Affordable Care Act is all about, making sure that all of us can count on the security of health when we get sick.
The point is this, Alex, he's passed a law, the Congress passed the law, it's the law. Now, it's not perfect, obviously. There's probably a lot of things wrong with it. Fix it! Try to make it work. Don't just try to strip it from us while you bastards have 4 choices of health care.
Well, in general, are you for a nationalized healthcare system, Governor?
In a country like ours, if you're sick, you should be able to go to the doctor, receive treatment, and hopefully get well. The problem with Obamacare is that they had to kowtow to the insurance companies, who of course pay them the money to get them elected, your corporate donors. Should healthcare really be a for-profit business? To the tune where these CEOs are making $5 million bonuses, if they're making profit at our health problems, then won't it be inherent for them to make us unhealthy? It's kind of like war, isn't it?
Well, according to Gallup, the uninsured rate dipped to 15.6% in the first quarter of 2014. It's a 1.5 percentage point decline, so it was up to 17.1% in the fourth quarter of 2013. And it's the lowest level recorded since late 2008 when our last recession hit Americans. The uninsured rate for every major demographic group declined in the first quarter of 2014. The uninsured rate for lower income Americans dropped 3.2 points to 27.5%, the largest decline within any key subgroup, while the uninsured rate for blacks fell 3 points to 17.6%. Hispanics remain the subgroup most likely to lack healthcare insurance with an uninsured rate of 37%, though their rate dropped 1.7 points in the first quarter.
So it's working a little bit, but it's not working to the level that it was promised to work at. They need to keep working on it. It should remain a job in progress, which means Republicans, get off your dumbasses and start working to make this better for all Americans so that Jesse Ventura can sit back and in amazement and say, holy crap, they actually did something?
Well, still, despite these numbers, it didn't stop Kathleen Sebelius, the current Secretary of Department of Health and Human Services, from resigning. Sebelius came under fire last fall for the rocky rollout of healthcare.gov, the website central to the new law's implementation. Republicans in Congress were especially critical of what they saw as her lack of leadership shepherding through what they saw as an ill-conceived, ill-advised law. Wyoming Senator John Barrasso went so far as to characterize her last October as the laughingstock of America.
I felt the same way about George Bush and Dick Cheney and everything that they did. George Bush and Dick Cheney, you could move what they just said right there, move it right over to them, and it would apply also. So did she need to resign? Maybe she did. But what she did and the way she operated was no different than Bush and Cheney, so they ought to make double copies and send the other one to Bush and Cheney with the same thing on it.
Well, President Obama intends to nominate Sylvia Matthews Burwell, director of the Office of Management and Budget, to replace Sebelius. She came to the White House from her spot atop the Walmart Foundation, the giant retail chain's charitable organization, which, according to its website, donated nearly $1 billion to causes worldwide in 2011. How generous of Walmart, right, Jesse?
You know, I got a better idea. Rather than Walmart donating $1 billion to the causes, why don't they simply just raise their workers' pay with that $1 billion? Because they're probably giving it to their own workers in a roundabout way.
Well, what do you make of Sebelius' resignation?
Well, you know, again, if you get in the crosshairs of the other political party, it's very rare that people stand with people. When something doesn't work perfect, buck has to stop and someone has to fall on the sword. Unfortunately, that was her, I guess. Why didn't they use the same analogy for 9/11? When 9/11 occurred, nobody had to fall on the sword for that. So here again, on health care, someone is held responsible. On 9/11, nobody's held responsible.
Well, for the 2014 midterms, Republicans believe they have a winning issue, insisting that Americans are opposed to the Affordable Care Act, and most polling is on their side. According to a survey by CBS News, 53% of Americans gave the law a thumbs down, compared to the 41% saying they approve of it.
Part of that is they got their forces out there, Fox News and that, and they keep browbeating the people, and the people are, start to believe it. If you tell someone something enough times, they begin to believe it. Ask the question, would you prefer national health care or another war? Because if we wouldn't have had all these wars, we could be paying for this health care 10 times over. And I challenge all my listeners out there, will somebody please tell me one thing that these wars have accomplished?
Well, still, are Republicans playing games? House Republicans quietly secured a recent change in President Obama's health law to expand coverage choices, which is quite the departure from their many attempts to repeal or dismember it altogether. They added a small provision for small businesses. It eliminates a cap on deductibles for small group policies offered inside the law's healthcare exchanges.
And if those things are good, keep working at it. It's a job in progress, is what I said earlier. You're paid to do that. That's your job. Healthcare's there. Fix it.
Well, according to David Espo at the Associated Press, no member of the House GOP leadership has publicly hailed to the fix, which was tucked, at Republicans' request, into legislation preventing a cut in payments to doctors who treat Medicare patients. So here we have Republicans secretly approving the Affordable Care Act, while at the same time they try to repeal it. Wonder why, Jesse?
Politics. We, the people of the United States, we're irrelevant. We don't matter to them. This is power play of the two parties. I've said it hundreds of times.
Right. Large business organizations that support repeal of Obamacare pressed Republicans to make this one specific change.
Now, why wasn't that headlines across America? Where was our media again? Asleep at the wheel, I guess.
Well, other problems face the Affordable Care Act. A recent analysis by the management consulting firm McKinsey & Co. found that only a fraction of the biggest local hospitals in a given coverage area will accept Obamacare patients. An AP study found that only 4 of the 19 cancer centers it surveyed would give Obamacare patients access to its cancer care through the new Obamacare exchanges in their states.
Well, I mean, but wait, if the care pays them, why wouldn't they honor the care? That's like turning away a customer, isn't it? What am I missing here? If you're in the cancer business and they cure cancer, you're going to be out of business. So when you have cancer patients coming into you, that's what you get paid to do. Why would you? That's like somebody walking in and you won't sell them something when you're a salesman.
Well, certain hospitals have certain deals with insurance companies, so they don't accept Obamacare.
Ah, now the plot thickens. As I said, there's your problem. They made health care at the whim of the insurance companies. I keep telling you that. The big money donors got in there and wrecked what could have been a good bill. Part of the reason you can't go here is because we got to deal with this insurance company, not with your insurance company. Notice who's running health care. It's not the doctors, it's not the nurses, it's the insurance companies.
Well, bottom line, Governor, is the Affordable Care Act a step in the right direction, or should we get rid of it altogether and start fresh?
No, I say, like I said, you got to give it 5 years, but people need to work at it.
Well, your viewers certainly had a lot to say about Obamacare. We asked for this from the People segment if the Affordable Care Act was working for Jesse Ventura fans. And we have a wide range of opinions on the issue. At Steve Bate on Twitter says, for the first time ever, me, my wife, and my brother all have insurance.
Obviously, it's working well for that family.
Sean on Facebook writes, let's do the math. 315 million Americans, 7 million people enrolled in the ACA. That's about 2% of the population that's even enrolled, and that's assuming they're happy with their coverage and premiums. It's a total failure that benefits too few.
I think people are premature to throw the dirt on it and bury it already without giving it the college try, or the United States of America try. Let's get together and make it work. But of course, the Republicans aren't about to do that politically, are they?
Tim on Facebook writes, Obamacare is absurd and infringes on people's rights. When we let government dictate what we can buy, what we can't buy, and when they force us to buy it, it is criminal and unconstitutional. Obama and his cronies can kiss my ass. I will never sign up.
When he gets sick, he'll have to deal with it. And then, of course, what he'll do, he'll go to the emergency room, and then it'll cost all of us to pay for his health care. Notice how the circle goes around?
Josie on Facebook says, I think Obamacare is fine. A change in the modus operandi of healthcare, which was needed, and now we have it. It may not be the perfect solution, but at least it's a start.
I agree. That's where I'm at on this.
Well, Cindy Kraft on Facebook writes, I now have insurance. They can't turn me down because of pre-existing problems.
There you go. There's another case where they could before. Now you can go get insurance and you can be dealt with. It's going to have good, it's going to have bad.
And for the final verdict, Robert on Facebook says, for the past 30 years, the political parties have used it as a tool for elections. Now someone has done something about it. It's not perfect, so we need to refine it, but Obama will go down in history for doing it.
You know, good or bad, he will go down for that. So people need to understand you're dealing with the magnitude of a massive federal government. It takes 5 years for anything to work right. All right, keep writing in with your questions and comments, and remember, stay vigilant, people. Year. Anybody that knows government knows that when you establish something from the ground up brand new, it's going to take at least 5 years. And so I think we're premature. But anyway, fire away, Alex. What do you got?
Well, President Obama stated 7.1 million Americans have signed up for health care through the federal exchanges set up by the Affordable Care Act, reaching the White House's initial projection. But let's not forget that the rollout of exchanges has been messy. The website, healthcare.gov, was useless for weeks after its launch last October.
Obamacare. I've said it before and I'll say it again. Having access to a doctor is a human right. But where do you stand, my vigilant viewers? That's today on Off the Grid. President Obama has announced that the Affordable Care Act, aka Obamacare, is working. You don't say. What do you guys out there think? That's on the docket for today. Alex in the command center, give us your latest on Obamacare, but not quite yet. First, I gotta talk a little bit and ask, are you guys bored back there at the command center? You're sending me a topic now that's only been in operation for about 1 year.